Professors Robert Furchgott, Luis Ignarro, and Ferid Murad. Your discoveries concerning nitric oxide as a signaling molecule in the cardiovascular system, your discoveries lifted medical research into a new era.
Nobel Prize research discovered that a high-quality arginine supplement creates nitric oxide. It relaxes the arterial walls, smooths the vessel lining, resists plaque, and diminishes the risk of heart attack or stroke.
So we just met Sherry, who's had a silent heart attack without the classic heart attack signs. Again, something that is sort of stunning. How common is this story in your own practice? And how do folks mostly find out that they've had a silent heart attack?
Well, it's actually a lot more common than you think. And sometimes people really feel nothing and we just pick it up on an EKG. But more often than not, it's like Sherry. People feel unwell, they just don't know what it is. And it's very easy to get misdiagnosed that way, especially as a woman, because even though we know that heart disease is the #1 killer of women, often when a woman goes to her doctor's office, to the emergency room, heart disease is not the #1 thing that a doctor's thinking of.
What are these risk factors for heart attack? The things that we know we should be taking care of: high blood pressure, high cholesterol, of course being overweight, we talk a lot about that, a family history, and smoking. Turns out these risk factors are the same for a silent heart attack. But Dr. Talani, you raise concern about a risk factor that actually is much more prominently found in people having silent heart attacks.
Absolutely, and that's diabetes. Because in diabetes, you have poor circulation and you have high blood sugar, and that actually damages the nerves. So diabetics don't feel the same things that you and I feel. So they can put their foot in a fire or stub their toe and not feel it. And in the same way, they can have a heart attack and not have symptoms.
Blood pressure. This is a pretty good example for me of what most folks don't appreciate is happening in their body. These are two organs. The cholesterol can deposit in the wall of an artery. But when you're born, it's pristine like this. You see how the aorta is nice and clean? There's nothing on it at all. It's smooth and glistening. It's got a Teflon-like lining. The kidneys coming off it are nice and big and plump. It's fantastic when you see it as a surgeon to see how beautiful the organ can be. Now compare this to what happens if you've got high blood pressure for your whole life. Look at this aorta. See how it's chewed through and rotten? You've got cracks all through it. It's rigid, no longer willing to bend. And look at the kidneys. They're shriveled and bent up compared to the kidneys we had before. It's that comparison that gets most people to say, my goodness, I didn't have any idea that could happen to my body. Now, I've got an animation to bring this alive, because these organs aren't alive. Look at this animation, and it brings into scope, into your vision, what's going on. There's a little yellowish plaque. It starts when you're very, very young, 18, 20 years of age. That plaque starts to grow in your 20s, your 30s, your 40s. It gets large enough that at some point, when you're 47 years old, all of a sudden something happens and ruptures. That rupture, that crack that happens inside of the artery is an open sore. Like any other cut in your body, you got to heal it. Yeah, what do? You put a scab on it. That scab rapidly, over minutes, begins to enlarge, and all of a sudden, kaboom! You just saw the leading cause of death in the Western world. That's what a heart attack is. And that's petrifying when you first see it. But when you appreciate it, you control your health destiny because you can influence the chance that might happen to you. It changes the game dramatically.
My blood pressure was rising and rising. I didn't know what to do about it. And it actually hit 156 over 95. Now, and that's what I said, wow, I got to do something. Now, some of you all might have higher blood pressure than that. But for me, that was significant. And David Davidson didn't know at the time, but he called me. He said, listen, there's this product that I want you to know about that is helping to save lives. A lot of people in Japan and Asia have been using it since, for years. People in Europe have been using it, okay? But the company's based in America, and he's working with the owner of the company. So when I heard about it and he told me it was helping to take people's high blood pressure down, I said, send me 6 boxes. So listen, I need a couple of boxes. My mom needs one. My dad needs one. I sent a box to Kevin, the person he's talking to, because his wife has lupus. And here's what happened. I started taking the product. I took 2 packets a day. One in the morning on an empty stomach and a glass of water. One in the evening before I went to sleep. And that's all I did. I didn't change my exercise or my diet. Within 2 weeks, my blood pressure went from 156 over 95 down to 106 over 73. I was blown away. When that happened, I became a crusader. Because I figured if this helps me out, it's going to help some other people. You see, ladies and gentlemen, there's an incredible need for what we have right here. And just to prove that to you, I'm going to just do a little experiment, okay? I'm going to need you to clear your laps, and those that are physically able to stand, just stand up for me for a second. Okay, this is only going to take maybe 5 seconds. Now, we have some information, and we're going to get this out. This is called the 22 reasons to try our product. And I'm going to mention some of these, and if I say something that you can either say yes to, okay, whether it relates to you or somebody you know, just have a seat, okay? And we'll see if there's a need for what it is that we're talking about today. So, for everybody standing, does this affect you or somebody that you know that has some type of heart disease, has had a stroke, cancer, or diabetes? If you can